So as a physical therapist, we try to help facilitate healing and teach people how to properly recover a little bit faster. And fortunately, I have Dr. Lynn next to me and specializing in PRP injections. So a lot of people ask me all the time, what are they and how they can help recover? And I was hoping you could shed some light on that.
Yeah, so PRP's been around for, gosh, probably close to 20 years now, mainstream-wise, but definitely more popular with the veterinarians. Even some of our dental colleagues have been using PRP.
That's how it was invented, right?
Yeah. Well, so actually, I think trauma surgeons were using it in the 70s.
Okay.
But it really had become mainstream for dentists and veterinarians. I think definitely in the early 2000s, it was kind of a common thing to see done.
Yeah, I remember reading an article about how dentists were utilizing PRP injections to help facilitate healing of dental work they'd done. And that was 2000s, right? But then this has evolved to musculoskeletal injuries.
Yeah, and so when we started doing this, when I started using the clinic, I was getting a lot of funny sideways glances from doctors in town.
Sure.
This is going back to 2014, and at that time we used a generic kit. We might just get 1 or 2 tubes of blood.
Yeah, what's a generic kit?
Well, I mean, anybody, you can Google it. You can get you can buy
on Amazon.
Or you can just go Google shopping and you can find a kit for PRP, $25, whatever it is, from China, and you can get a kit to draw a tube of blood and you spin it in a centrifuge. You can separate out the platelets and the red blood cells,
sure.
But you're only going to get maybe a 1.5 or 2x double the concentrate. And what we know from the research over the past 10 years, especially because of Dr. Centeno and Dr. Schultz in Colorado.
Good book.
That they, you need a higher concentration because the platelets contain growth factors and cytokines. Those are the signaling proteins that turn on the healing process.
Right.
So when you get a PRP shot, all you're trying to do is take the mechanisms, the cellular mechanisms your body normally uses to heal, and then put it where the problem is.
Right, right. And the way I explain it to people, I hope this is accurate, is platelets essentially turn into something called fibroblasts, which that is what creates new connective tissue, muscle, ligament, tendon. Is that accurate?
Well, so, I mean, it's not going to turn into everything, but fibroblast is like scar tissue, basically.
Right.
So when you get, for example, you get a cut in your hand, right?
Sure.
It should stop bleeding within 60 seconds or so. You get that scab that forms, and then a week later the scab falls off and your skin's all healed up, right? So what happens is you get the cut, the platelets detect the damaged tissue, they release their growth factors, they coagulate the cut, stops bleeding, and then they're sending out signaling proteins to tell other cells to come into the area, fibroblasts to lay down scar tissue to get that cut to kind of pucker up. You look at that scab, you can see the edges kind of tensing up. And when the scab falls off, you've got skin underneath there, right? So that's basically what's happening is when you get a PRP shot, doctor's going to take some blood, separate out the red blood cells, just get the platelets. Hopefully, the doc's going to use a high concentrate because we know, for example, a 17-year-old soccer player or a 27-year-old runner with a knee injury has very different mechanisms of healing than a 77-year-old marathon runner.
Correct. Less viable tissue.
You have less viable tissue, you have fewer stem cells to work with, you have less receptors for the growth factors to target.
Right.
So basically, as you get older, you need a higher concentrate to get more relief.
Yeah. But I liked your analogy with the skin, like a cut. And I've always told patients, well, you get a scar on your body, the same thing happens internally, into your muscles, ligaments, tendons. Not to a certain degree because you're not dealing with the epidermis. But, as physical therapists, we're always trying to improve motion and reduce any kind of fibrotic tissue and tendinitis or tendinosis. But
right, you want to. So what happens a lot of times in the healing process as we age, we don't have that good blood supply.
Right.
Part of the healing process means that when you first get injured, right, that cut, you need cells going in. They're going to help fight off infection. Cells are going to move in to stop the bleeding. But in a week later, the cells that are busy around that cut, they're very different from the cells that were working right when you got the cut.
Right.
Which is very different from 2 weeks or a month later.
Right.
As time goes on, you're going to have other cells called macrophages moving in. And the macrophages are like housekeeping cells. They're going to
get rid of the dead tissue.
Get rid of the scar tissue, right? Because when that scab first falls off, you got all that pink, itchy granulation scar tissue. But what you want is that to be replaced by healthy skin.
Yeah, epithelialization.
Right. Yeah.
On the skin. But so typically, people always ask me, well, how many platelets am I getting injected? So what's typically in our system at any given time? And then I believe you had told me a couple weeks ago your count that you're trying to always hit with a super concentrated plasma injection.
Yeah, so there's a couple ways to look at it. I think back 10 years ago, people simply said platelet rich plasma, which stands for PRP, which means let's make sure the plasma we have is enriched with a high concentrate of your own platelets.
Higher than normal.
So 2x and 3x is more than 1x. But that was, again, 10 years ago. So now we look at that. There are a couple different ways. Some doctors will simply say, look, we need 1 billion platelets. And so there's systems that are designed to do it that way. The way that the doctors at Regenerative do it is relative to your particular count. So in other words, the way we process platelets in the Regenerative lab is going to be based on your particular count. I mean, your count is different from my count. Right? And we're not going to know till we actually do a blood draw. But based on our protocols, we know that, hey, if Dr. Jones has an injury and we want to give him a 10 times concentrate, we know based on our protocol, we can 10x the platelets we're going to inject.
Yeah, based on how much platelets you get from my blood.
Yeah.
Which you did on my shoulder, so thank you.
That was a while ago.
Yeah, it was a while ago. Yeah.
How long ago was that?
Oh, man, it's 20, oh my gosh, you're making me think 2020, I believe.
Was it 2020?
Yeah, 4 years ago, but hey, full motion, full strength, it's all good.
Did you still have any shoulder problems there?
No, not really, not really. But people always ask me, how effective is it, right? What percentage can I improve?
So I think the way to look at any of these injections, they're not a miracle fix, right?
I did a lot of therapy, by the way.
Yeah, so that's one thing we should talk about is how important the rehab is afterwards, because we can inject stuff all day long, but if you don't get the muscles retrained, right, that injury is going to keep happening again.
Yeah.
But how effective is it? It really depends on how bad the damage is. If you have a complete tear and the edges are retracting, these platelets are not going to magically pull everything together again.
Unfortunately, I had a partial tear. Subscapularis is the one that turns your arm in, but yeah.
So partial tears definitely do better, do much better. Partial tears, even bad strains, or what they call an interstitial tear, where the fibers interior to the tendon kind of get stretched and a little torn. But overall, the muscle tendon is all still intact.
Right.
That's a lot of times people have really painful shoulders and they see their ortho, and the surgeons say, hey, you're not a candidate for surgery, and the patient's kind of wondering, okay, why am I getting cortisone shots again? Why would I do that?
Which is catabolic. It breaks down tissue, and we're trying to do the opposite with physical therapy and regenerative medicine.
Yeah.
So people always come in and say, my shoulder really hurts. And in my mind, that's always a good thing, because we get really worried when there is no pain and no function.
And that's interesting, because we've talked about this.
When a muscle completely tears.
Well, if it completely tears, that means you don't have anything working. But
a rupture.
But a common thing a lot of pain clinics are doing these days, and I know we've talked about this, which I'm trying to understand, because every single physician goes to the same medical classes to understand the anatomy. So I don't understand why some physicians are doing this thing called RF ablation, which is cauterizing the nerve.
Radio frequency ablation.
So it's a pulse of energy designed to burn away, cauterize, fry, whatever you want to call it, destroy the nerve so you don't feel pain coming from the shoulder. The problem is, of course, when you do that, you no longer have control a lot of the muscles that carefully keep your shoulder moving.
Right.
So
because it's mixed fibers, it's not just sensory or just motor, it's both. So you're going to lose sensation, no pain, but then you also lose control of your muscles, so atrophy and poor arthrokinematics, the way the bones and joints move.
Yeah.
Very scary.
I don't recommend that procedure at all. I mean, and so hopefully people who are listening and watching, if you're thinking about getting something called an ablation, RF ablation, cauterization, burning away a nerve block for your shoulder, I mean, there are situations when you would do that. Like if you're totally paralyzed, you had a stroke, you can't move it.
Yeah, hemiparesis, I've seen they can control their shoulder. It's a lot of pain.
So just fine, fry the nerve if you can't move it. But if you are an active athlete, or someone who just wants to get out and surf or golf, and your shoulder moves but it's painful, do not let anybody ablate that nerve, because you're basically, it really is just putting duct tape on the check engine light of your car. You don't know what's going on. It's just going to get weaker. It's going to get more damage.
Yeah, no sensation, no perception of pain or mechanoreceptors where your body's at in space. You're not aware of what's hurting anymore, so dangerous. Yeah, thanks for answering the questions about PRP. That's usually my most common question is how often do I need it? What percentage will I improve? And I think the best answer is that it depends.
Well, typically when we first started doing this, the attitude was, oh, we can inject cortisone or we can inject platelets. Which one should we inject? The way to look at it is which one has more of a net positive effect on your body.
Right.
Because overall, it's still an injection. It's still a needle that's got to go in there.
Yeah.
But what you want to look at is, okay, the cortisone, we're worried about, okay, it's going to work fast, but it's also going to potentially damage the tendon, the muscle. It's going to weaken structures overall, and it's just temporary, but it works fast.
Catabolic, breaking down
Catabolic,
tissue.
because it breaks things down.
Sure.
When you put the platelets in, they take a little longer to work. When I say longer, I mean instead of days, we're talking like a week or 2 or 3, but it's there to try and get those tissues to heal and thereby help the pain.
And I learned firsthand that it's acute inflammatory process.
Yep.
So we need inflammation to heal, to help repair tissue.
Yeah.
And for about a good few days there, it's pretty sore.
Yeah.
But you could tell that it's working. Localized inflammation. I thought it was personally unique to go through. So I think viewers would love to see a little bit more of that too.
I think that if you're listening and you're thinking about getting a PRP shot and your doctor tells you this isn't going to hurt a bit or you're going to feel better right away, you might not be getting the PRP shot you think you're getting, because what you want is that shot to stimulate blood flow. We want tissue recovery and repair. And so things like ice or Advil or Motrin or cortisone shots, which are really different, they're designed to, they're anti-inflammatory, right? Their goal is to constrict the blood vessels, reduce that. We don't want that. We want blood flow. We want the circulation to deliver circulation and cells to the area.
I'm curious to know your thoughts though on this, because physicians I've met over the years have had differing opinions about the old school rest ice compression elevation. And I know a lot of
Well, you
people
looked at the studies on this too.
Yeah.
So, I mean, have there been any other newer studies? I think this actually came out 2013.
Yeah, it's been a few years.
It's been a while.
Over a decade.
But you still see it. So many clinics, particularly pain clinics, are still, if you hurt, just use ice or. Any new data on that sort of thing? Or?
No, I mean it's for temporary alleviation of pain. So if people can't move, and you can utilize some modalities like TENS or even ice topically. I usually only recommend the first couple days, but I don't know how you feel about that.
Yep.
I would say 2 to 3 days just to reduce pain. However, after those 3 days, you need cell proliferation. We need more tissue to the area to help regenerate what has been damaged. And if this goes on for 7, 10, 14 days, you're only prolonging healing.
So I think that's the lesson there, is if you are struggling with pain and your trainer or your therapist or your doctor or chiro is still telling you to ice it and it's going on for a couple weeks, then you probably should look at something else.
I've seen it as far as like 6 weeks. I'm like, stop.
It just means it's not just inflammation. There's something else going on there, right?
Correct. And I mean, there are post-surgical protocols where they use game-ready devices that help reduce inflammation from the surgical procedure.
I wonder if there's been studies looking at ice hindering recovery from surgeries, though. Because I would think you would not want somebody to ice an incision.
Yeah, I know like 10 years, 15 years ago, they were doing a lot of game-ready is essentially have you heard of these?
Yeah.
Yeah.
But that's more to help with the inflammation for range of motion.
Yeah, just post-surgical. It's a compression device, let's say ACL surgery, and they wrap it around your knee, and it pumps cool fluid every 10 minutes, every hour. It just kind of circulates cold fluid. But they only use that for first week.
I mean, that would definitely help with range of motion because you have less pain, but I wonder what that does to the actual, I wonder if it negatively affects tissue healing or wound healing.
Get back to you on that.
Yeah. Okay.
Something I need to look into.
And so I think the downside, people always want to know what the downside is. Remember, PRP can be sore. And so I know that there's been times when I have told patients we've done rotator cuff injections of platelets and we tell them you need to do rehab, and we had a patient who didn't want to do it. and they ended up with a frozen shoulder.
Sure.
Which is not what we want, because then they had to see their surgeon, who went to take him to the OR.
Which, by the way, is my nightmare. So when people get injured, whether it's your knee, hip, shoulder mostly, because the tissues are a little bit closer together, there's something called the capsule. It's made up of the ligaments, and that's what holds our bones together. But if you don't have proper motion, those tissues can kind of adhere together, hence the word adhesive capsulitis. And the way we loosen that up is through passive range of motion initially, but when people are so injured, they're fearful of moving, fear avoidance. And unfortunately, it happens in our older geriatric population a lot. Yeah. And then they're left with debilitated shoulders, and then that leaves you more susceptible to rotator cuff tears, sprains, the cascade. So that's why I, as a physical therapist, highly advocate moving soon and often. And we're kind of crossing lines here, but that's no different than with your PRP injections too.
Well, we were talking about this before we started on camera. Mm-hmm. What about acupuncture? What about cupping? What about,
I got that question last night. That's why I brought them.
What about deep tissue massage and things like that, right?
Sure.
I mean, as you're talking about, there's scar tissue, there's adherent layers of fascia, the layers of tissue, right?
Right.
But if you truly have injured muscle, a tendon, where there's scar tissue, what you need sometimes is to break that up and rekindle the healing process. Right. And because as we age, we don't have as good blood supply. I mean, you look at a baby, if you take care of a newborn, they can have horrific looking rashes, and by the next day, it's totally resolved.
They have a higher quantity of stem cells viable in their tissue.
And they have great blood supply to everything.
In their muscle tissue too, right? Because most people think stem cells are only in our bone marrow. However, they're in our fat cells.
They're all over.
Yeah, mesenchymal stem cells, right?
So that whole recovery process is so much faster if you've got great blood supply and lots of stem cells. When you don't, as you age, because we know that when we get to our 50s, 60s, it just drops off. I mean, anybody else who's out there in their 50s can feel it, right? You go work out, it's not as, the recovery is not nearly as quick.
I'm in my late 30s, and I got a few.
Love to be in my 30s. But
so you touched on something, and people always ask me this question too. So I have scar tissue from an injury. Will it ever go away? And my answer is always no, because imagine a scar on top of your body. The scar is going to be there, but you can improve the quality of the scar. Same thing as the tissue inside your body. So we use all these little scraping tools and cupping methods to help improve the mobility of the scar tissue. But once a tissue is damaged, if you don't take care of it, there's more susceptibility to re-injure it. So that's why you need therapy. Yeah.
So the way I see it is, for a long time, people would say, "Oh, I had a frozen shoulder. I just hung in the jungle gym and it got better," right? Or someone just popped it back into place. I don't know exactly what's going on there, but I do think some of what's happening when people have pain is there's scar tissue, and you do need to break it up.
Oh, yeah.
So could you go through with a deep tissue massage and manually break it up? And on a microscopic level, you're stimulating blood flow.
On superficial?
Superficial, you could, right?
Right, but the joint capsule is a different story.
Well, but then could you go deeper by using something more aggressive, maybe a tool like a cupping or something to kind of break it up?
Don't touch it.
So could you maybe use something like acupuncture, take an acupuncture needle and physically get in there and cause some micro trauma and some hemorrhage and platelet stimulation? I mean, that's kind of what happens with
not for the capsule, though.
Not for the not for the capsule, but
for the soft tissue around.
For soft tissue, even for some rotator cuff, because people say, "Oh, I had a rotator cuff tendinopathy and I saw an acupuncturist, totally went away." Well, probably they got in there deep enough and they were able to stimulate some of that. Right?
So I mean, there's some crossover with acupuncture and trigger point. So dry needling, excuse me. Sorry, I lost the word.
I think myofascial pain, trigger points, I mean, for decades, we didn't have PRP. We didn't have stem cells. We weren't even using cupping that aggressively. Yeah. So all you had was, we'll inject using lidocaine or whatever Terrell and Simons were using back then.
For those who don't know what dry needling is, it's essentially just using a acupuncture-like needle and then doing small punctures to the area that's affected to facilitate healing or inducing localized inflammation to help repair the tissue. It's pretty cool.
Yeah, and by the way, in orthopedics, there's a similar procedure called tenotomy.
Yeah.
And all they're doing, so commonly, for example, for tennis elbow,
Yeah.
all they're going to do is take a scalpel and then run it across the scar tissue right where that common extensor origin, and just break up the scar tissue and stitch it up. It's not, a super complex high-tech procedure. It's actually pretty low-tech.
But don't they also do that in orthopedics with microfractures for the bone?
Yeah.
Maybe I'm not saying the right word.
Yeah, that's the theory behind it, to create to create some micro trauma in there. So,
Right.
so definitely, acupuncture done in China for centuries, right?
Sure.
But then also there's prolotherapy, which has been around for decades.
50s,
Prolotherapy,
I believe.
50s.
Yeah. For
You just-
ligaments, that's when ligaments get loose. And correct me if I'm wrong, but you inject lidocaine and dextrose, essentially sugar solution, to help irritate the ligament.
So there's different, prolotherapy stands for proliferative therapy.
Right, cell
And the
proliferation.
idea is to stimulate tissue growth. So if you've got tendon or muscle injury full of scar tissue, the theory was you could go in with a needle, mechanically break up the scar tissue and inject some type of agent to cause inflammation. Because what's
Yeah.
inflammation? More blood flow. So I think doctors did that for decades because all they had was prolotherapy. I mean, there were no platelets or stem cells. So I think more on a microscopic level, though, what the prolotherapy treatments were doing 50 years ago was breaking up that scar tissue and triggering some hemorrhage and the platelets going to the area.
Yeah.
So the difference we have now is instead of going through all that, we can just go directly to the blood and take the platelets out and concentrate them.
I think it's super cool.
Yeah, yeah, it's a very,
Yeah.
it's definitely a more refined process.
Yeah, absolutely. And you could speak to the effectiveness of not just muscles, ligaments, tendons, but you also do it interarticularly or in the joint as well.
Oh, yeah.
Yeah.
So knees, we treat a lot of knees, we treat a lot of disc herniations. The point is, this is 2024. There's a lot better and safer ways to treat all these aches and pains, much better than using cortisone. And definitely your doctor should be going over these as choices with you before you get that surgery done.
Sure. And I mean, I've done videos on this on my channel too, but with intervertebral discs, with degeneration, the only way we get vasculature or blood flow is through the vertebrae end plates itself. So when people don't move, there's no blood flow going to the annular fibrosis or the nucleus pulposus, and that just shrinks over time. So with physical therapy, our whole idea is to promote blood flow to help improve the degeneration that has occurred, and then you're simply just getting right in there.
Yeah.
Yeah, I mean, it's awesome. I think it's super cool.
Well, always good talking to you, Brian.
Yeah.
Whenever we
absolutely.
sit down, we got a lot to talk about. But
Yeah.
if any of your listeners have questions, they should definitely be
Yeah.
sending them in.
Yeah. Reach out with any questions in regards to soft tissue healing, PRP, dry needling, any physical therapy techniques that you're curious about, such as cupping or scraping. Happy to answer any questions in that aspect.
Yeah.
But yeah, especially with PRP. Oh, one last thing.
Yeah.
So you said in the past, in the origin of PRP, they were using 1 to 2x concentrations. And what is your focus right now?
Oh, so yeah, with the Regenix labs, we can get the concentrations to 20, 30, even 40x, 40 times if we have to. We don't always do that because when I first started using the lab system, I think I dialed it up too high a couple times. We triggered a little bit too much inflammation. It was really uncomfortable. But
Sure.
But the point there is 2024, we want to be able to customize that concentration depending on how bad the tear is,
Great answer.
how large the tear is, overall medical history. There's other things to consider than just using a generic kit. But if you're thinking about getting an injection done at all, I'd rather you get a simpler, older, lesser refined PRP treatment than a cortisone shot. Because generally speaking, it's going to be much better for your injury than that cortisone will.
Right.
So ask your doctor about it.
Yeah, great answer. So thanks for your time, Dr. Lin, and again, Dr. Brian Jones. And
Okay, Dr. Dwight Lin.
yeah, so it's been a pleasure. Look forward to our new episodes coming out soon.
All right.
Aloha.
Bye.